Good afternoon. My name is Alan Unell, and this series of videos is Healthcare Reform Advocacy. It's about problems in the healthcare system and things that we can do to help make it better for all of us. Previously, we have discussed, or I've written about in the Healthcare Advocacy Newsletter, a number of stories about life expectancy in the United States. What affects life expectancy is complicated. And the data reveals that there are many problems, and we'll discuss a few of them today. It's worth noting that life expectancy varies in different locations in the U.S. Urban areas often do better than rural. Wealthier areas have longer life expectancies than poorer. You would kind of expect that. The Washington Post did a year-long study on life expectancy and found that chronic diseases are killing people under 65 far more than gun violence or opioid addiction or suicides combined. And let me point out to you, I'll have links to all of the stories and studies in the Healthcare Advocacy Newsletter link that'll be in the description box. You just click on that and you'll find all of them. So today, the divide between the nation's poorest and wealthiest communities is wider than it was in the 1980s. But that finding masks a sobering reality. People in wealthy communities in the United States live shorter lives than their peers in Canada and in France and in Japan. And the same is true for people in the poorest communities. So overall, we've got a life expectancy problem. Well, let's take a look at causes. Politics plays a role. Republican states fare worse than Democratic states. Decisions made years ago by elected officials are complicit in the nation's life expectancy crisis. When Reagan was president, states were given more authority over how to spend federal safety net dollars. Does this sound familiar? Does it go back to, we'll fix it at the state level? Okay, sorry. The way states used those funds were different between Democratic and Republican-controlled states. The Republican states did not invest in public health initiatives. They said it cost too much or it overstepped cultural bounds or whatever. And today, people in the South and the Midwest, which are regions largely controlled by Republican state legislatures, have increasingly higher chances of dying prematurely compared to those in more democratic areas like the Northeast and the West. Components, cigarette taxes, seatbelt laws, public health spending, policies on those and other issues help determine the rates of chronic illnesses like lung cancer. Let's look at Ohio. It's a Republican state, I'm sure you know that. It's a good example. They are in the bottom 20% of life expectancy of all 50 states. Their life expectancy is similar to Slovakia or Ecuador. And 1 in 5, 20% of all people in Ohio are going to die before the age of 65. I was shocked to read that. One Republican legislator commented that he did not want to be a smoking Nazi and raise tobacco taxes and tell people what to do. Okay, big deep breath. Part of the legislative problem is that when they make policy choices that do benefit public health, it involves making, sure, they're tough choices, but they don't have visible results right away. Legislators are going to be long gone before the results of longer lives lived become a reality. Additionally, by, of course, pandering to fear of the other or fear of government, distrust of science and experts, and not implementing policies that can keep people healthy, you're willing to let them choose long-term grief over short-term pleasure. Is that the right thing? I don't think so. Anyway, lifestyle matters as well. It's another factor. Of course, we know smoking can seriously shorten your lifespan, but diet plays a part too, as does exercise. In the last 50 years, the weight of the American male average weight has increased substantially. Men now average about 200 pounds. That's way bigger. It's the same for women. They've gone up a similar amount. Excess weight tends to lead the way to other chronic conditions that can be tragic: diabetes, fatty liver disease, cardiac issues, etc. Some experts have identified the rise in the availability of heavily processed foods as a cause, which of course I love. High salt content, lots of sugar, high calories, it's really cheap, it's readily available. All in all, it's not a good combination for everyday diet. How about the focus of healthcare? There is going to be a link to an opinion piece that was in the Washington Post, which kind of summarized their year-long investigation, and that'll, again, be in the link below. It was written by the entire editorial staff of the Washington Post. Now, they captured an interesting idea that, frankly, had not occurred to me. The healthcare system that we have is not really a healthcare system. It's a sickness system. It provides incentives for managing sickness, not health. The challenge is that building a healthier population doesn't pay nearly as well as treating a sick one. Pharmaceutical companies profit when they create drugs that treat disease rather than the drivers of it. The more patients a private medical facility sees, the more money it makes. The article that they wrote notes that more people have health insurance, but we're dying sooner, so they claim that insurance isn't the issue. On that one, they're wrong. There was not a study, but an experiment, with real health insurance that was done in the 1990s by the Rand Corporation in Santa Monica, California. What they did was they looked to see how do people use insurance when deductibles and copays go up. And they found the slightest increase in deductibles and copays, and people start dropping using the insurance. It plummets a lot. So having insurance is really not the same as using it if it's expensive to use it. Okay, let's summarize this. People are dying from chronic conditions earlier than ever, and in more numbers than guns and opioids and suicides combined. We have a sicker population that lives shorter and shorter lives. Turning this around is complicated, and it has many facets. Everyone needs to be able to see a doctor for wellness care when they're sick. And there should be no copay or deductible, so that doesn't become an obstacle to them going to see the doctor. We also need to address the social determinants of health. This includes making sure that there are healthcare facilities not nearby, not hours away, and that we can get there. That might involve childcare and time off from work and all kinds of things. Prescriptions need to be affordable. Not just those 10 that were passed recently in Congress, but all prescriptions need to be affordable. And P.S., that RSV vaccine that you've been reading about, I went to the pharmacy the other day, and I'm old and have Medicare. If you don't have Part D Medicare, good luck, $300. Okay, our legislators need to include public health legislation that really matters. It's not the nanny state to raise taxes on cigarettes. There are more studies to show that for every nickel more that a pack of cigarettes costs, a significant number of children don't start smoking. And you know what? Children smoking, they don't get sick right away. It takes decades for the diseases, heart disease and cancer to show up. H.R. 3421, the Improved Medicare for All Act, universal health care, fixes some of the issues, but not all. It provides a way to improve and expand the number of health centers that provide health care into rural and medical deserts, and it eliminates deductibles and copays. Senate Bill 2840, the Bipartisan Primary Care and Health Workforce Act, will bring more physicians and nurses into the system and increase the capabilities of community health centers. Those are centers run by about 1,400 agencies in the U.S., and they provide health care to 30 million of us. Okay, let's take an action. I bet our representatives and our senators are not as well aware of this as we are now. So let's let them know so that they can take the appropriate action. Now you can use ResistBot on your cell phone to send an email, which I'll have in the link below, telling them just what I told you here. All you have to do is text SIGN, S-I-G-N, PQIQVC to 50409 to tell them how H.R. 3421 and Senate Bill 2840 will help make a dent in increasing life expectancy in the United States. Okay, like, share, subscribe. All the links will be below for you. Have a great day.